I'm Raphael Wittenberg. I'm an economist by profession. I've worked for many years. I was working part-time at the London School of Economics and part-time in the Government Economics Service. I'm now at the London School of Economics and at the University of Oxford leading research proposals and research studies. The work that I do at LSE is within the Personal Social Services Research Unit. This is a unit that was established over 40 years ago, originally at the University of Kent and now also at LSE at Manchester, and is specialised on research on social services, services for older people and mental health services, and established a very substantial reputation in those fields.
How would you explain what you do to a layperson?
My work is mainly leading research proposals, a lot of them funded by government departments and agencies or medical charities. So what I'm doing is I'm writing the research proposals along with colleagues, of course, as to what we plan to do as part of our study. We then submit these proposals to organisations which fund research, and if they're successful, we then conduct the research, which may involve looking at the literature. It may involve, in some cases, collecting new data, often though analysing existing data which others, such as the Office for National Statistics, may have collected. When we've conducted our analyses and our literature review, we write up reports, both for the funder and for academic journals, and we give conference and seminar presentations on our work to try and convey our findings as well as we can to those who would have an interest: decision makers, patients, service users, and the general public.
What would you say are currently the three main policy priorities for long-term care in England?
There's so many challenges at present that I actually found it difficult to limit it to three. So if I'd be allowed five, if that's possible. The first issue is that of resources. There's, I think, a widespread view that adult social care, particularly in England, is underfinanced, and the resources available have fallen substantially over the last 8 years or so. So that, I would say, is issue number one: resources. There is a very controversial and tough means test for social care, particularly in England, a bit less in Scotland. And the house of the individual is taken into account as part of their savings if they go into a care home. There have been 20 years of debate as to how to reform that. So I would say a priority is to act on that tough means test. Thirdly, a lot of policy attention has been paid to supporting and helping the 5-6 million unpaid, mainly family carers, who in fact provide the vast majority of care. And given a lot of the demographic pressures and uncertainties, I think support for carers should be, and is in fact, a very high priority. A priority, I think, is also rightly being given here to the integration of health and social care, and also some other services like specialised housing, in the interest both of service users, so they can get a properly organised and coordinated package of care, and in the interest also of the taxpayer and the service providers. And finally, my fifth one would be prevention. This is a difficult area in the field of social care with limited evidence, but clearly if we can reduce the onset and the deterioration in some cases of disability, that would be extremely valuable.
To what extent do you think these priorities have changed in the last 5 years, if at all?
I would say most of these priorities have not changed in the last 5 years, but have become in some ways more acute, especially the funding priority, because the real terms resources available for adult social care. So say local authorities spending on social care has gone down pretty much year on year since 2010 at least.
If you have an opportunity to introduce one new long-term care policy in England, what would it be and why?
Well, if it would count as a policy, I would say to provide more resources for adult social care. That would then enable some of the other developments to be funded, such as making the eligibility criteria less tight, making the means test less tight, and, for example, promoting more support for carers. If I had to choose one very specific measure, I would say that because of the huge controversy that has surrounded it over, as I say, 20 years, I would reform the funding rules, the means test rules, by introducing a lifetime cap on care that was recommended by a specialist committee here, over 6 years ago now.
And in terms of research priorities, what do you think is an outstanding piece of research on long-term care that needs to be carried out in England?
My top priority, and it's a difficult one, will probably be evaluations of the cost effectiveness of a range of different services. There is limited evidence about what is effective and cost effective and its value for money in the adult social care fields. Even for older people, there's limited evidence. For some of the younger adult groups, like people with learning disability, even less. We do not know anything like as much about what works and is value for money in adult social care as in many areas of healthcare. So I think that would be the priority. Within that, hard to say. I think learning disabilities, where the numbers are growing, and so because of improved survival, is perhaps a particular priority, but not the only one.
So I'm now going to ask you a few quick questions, and I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. Firstly, what policy priority is allocated to long-term care in England?
In theory, quite high. In practice, I would say it has tended to be low in recent years. I probably couldn't give it more than about 3.
How aware is the general public in England of what the long-term care system offers to them?
We have firm evidence from surveys that unfortunately there is a lot of misunderstanding among the public about what social services can offer, and including, perhaps particularly around the means test. There's a big need for better explanation about the system. So I think, again, I could give no more than 3.
How well does the system support people with long-term care needs?
I think, again, the huge cutbacks that we've seen and the reduction in the numbers of people, particularly older people, particularly people with mental health problems over the last few years, has been so extensive that, again, I would say a lowish score, perhaps 4.
How well does the system support the needs of carers?
Carers have been a very high priority, with successive governments giving it a priority and publishing carer strategies and updates. But I do feel that a lot more could be done and a lot more should be done. And therefore I would say again about 4.
How integrated are social care and healthcare services in England?
It's been a huge sort of striving for improving integration, but there's also quite a way to go, and of course a lot of different schemes being tested at the moment, and I gather with varying degrees of success. So I would say 5.
Thank you so much for your time.
Thank you very much.